It's important to know how to address clogs to ensure the proper function of the tube and the comfort of the patient. Before attempting to unclog the tube, you must be sure it's actually clogged. Signs of a clog may include resistance when flushing, sluggish, or no flow of liquid, or patient discomfort. To unclog the jejunostomy tube, you'll need warm water, a syringe, a small tube brush, and clean disposable gloves. Be sure to wash your hands thoroughly and put on the gloves. First, draw up warm water into the syringe. Attach the syringe to the tube's port and gently push the warm water to try and dislodge the clog. Apply gentle, steady pressure on the plunger to push the warm water through the tube. If the clog is minor, this might be enough to clear it. Pay attention to the flow of water. If it starts to flow smoothly, the clog may have cleared. If not, you may need to proceed with the next step. If flushing with warm water doesn't work, carefully insert the small tube brush into the tube. Be gentle to avoid any damage to the tube. Slowly and gently maneuver the brush through the tube to dislodge the clog. Do not force it. If you encounter resistance, stop immediately and consult your healthcare provider. After using the brush, flush the tube with warm water again to help clear any remaining debris. Observe the flow to ensure it's smooth. If flushing with water or brush don't work, an enzymatic declogging agent can be used, which can be purchased over the counter. If the clog is not resolved, please do not hesitate to reach out to your healthcare team. Once the clog is cleared, assess the jejunostomy site for any signs of irritation or infection. Clean and change the dressing if necessary. Dispose of used supplies, remove your gloves, and wash your hands thoroughly. Document the procedure and inform the healthcare team of the unclogging process. Properly unclogging a jejunostomy tube is essential to ensure the patient's well-being. Always follow your healthcare provider's instructions and maintain a sterile and safe environment. If you have any questions or concerns, don't hesitate to reach out to your healthcare team.